Hi everyone. Today's topic of discussion is in fact an extension of the last video, that is anatomy of nose. Today you will be learning about the blood supply of nose, and along with that you will be going into the details of epistaxis, that is bleeding from the nasal cavity. Only if you know the blood supply of nose will you know how to control an epistaxis, which is a very common scenario, and if uncontrolled it can be an alarming situation for the surgeon as well as the patient. So it is very important that we learn about the blood supply of nose, and I'll be starting with the two systems which supply the nose, that is the internal carotid artery system and the external carotid artery system. I'll start with internal carotid artery system, which gives rise to the ophthalmic artery that passes along with the optic nerve through the optic foramen to enter the orbit, and once it enters the orbit it gives rise to two branches, that is the posterior ethmoidal artery and the anterior ethmoidal artery. The posterior ethmoidal artery goes through the posterior ethmoidal foramen, which is a part of lamina papyracea, and then it enters the nasal cavity. Similarly, the anterior ethmoidal artery passes through the anterior ethmoidal foramen and enters the nasal cavity. And how does it pass into the nasal cavity? Anterior ethmoidal artery is passing through while it passes above the anterior ethmoidal cells, that is at the roof of the ethmoid, it passes to reach the cribriform plate of ethmoid. While it passes, it forms a nipple-like projection, as you can see here. This is the nipple-like projection that is seen here. This nipple-like projection that is produced by the anterior ethmoidal artery is what is meant by Kennedy's nipple. You can see this is JF Kennedy, right? Kennedy's nipple, but it was actually named after David Kennedy, the famous American rhinologist. Okay, and for you to remember, I kept this picture, and it forms the projection called Kennedy's nipple. And where is it seen? It is seen at the junction of superior oblique and medial rectus muscle. Okay, superior oblique and medial rectus muscle, and after that it goes above the ethmoidal cells usually. Sometimes it transfers across the ethmoidal cells when it is lying in a thin mesentery. It is hazardous because if you are doing a endoscopic sinus surgery and if you are not taking a CT scan, there is high risk of injury. Okay, so this anterior ethmoidal artery then goes into the cribriform plate of ethmoid, and from there it goes on to supply the nasal septum as well as lateral wall of the nose. Okay, so this is how the anterior ethmoidal artery enters the nasal cavity. Similarly, posterior ethmoidal artery also enters the nasal cavity through the posterior ethmoidal foramen, and you can have an exact location of where it is entering by looking at the landmark anterior lacrimal crest. What is this anterior lacrimal crest? Between the anterior lacrimal crest and posterior lacrimal crest you have the lacrimal fossa, on which is lodged the lacrimal gland, right? So this anterior lacrimal crest forms it is the landmark for these foramens. You have the anterior ethmoidal foramen, and then posterior ethmoidal foramen, and finally optic canal. Anterior ethmoidal foramen lies 24 mm behind the anterior lacrimal crest, and posterior ethmoidal foramen lies 12 mm behind the anterior ethmoidal foramen, not anterior lacrimal crest. Okay, it is 12 mm behind the anterior ethmoidal foramen, and finally you have the optic canal, which is seen 6 mm behind the posterior ethmoidal foramen. Okay, so the rule of 24, 12, 6, that is you have the anterior lacrimal crest, and 24 mm behind that you have the anterior ethmoidal foramen, 12 mm behind the anterior ethmoidal foramen you have the posterior ethmoidal foramen, and 6 mm behind the posterior ethmoidal foramen you have the optic canal. Now, what is the importance of these landmarks? When you are having bleeding in the orbit because of the injury to anterior ethmoidal artery, the blood vessel will retract back into the orbit, and it can result in an orbital hematoma. In that case, to save the eye, because when there is orbital hematoma, it can result in optic nerve ischemia. to prevent blindness, you will have to do something immediately. One thing you can do is a lateral canthotomy and cantholysis. That is one thing. Apart from that, what else can be done? You can do an anterethmoidal artery ligation, and for that you have to access the anterethmoidal artery fast. For that you can put a Lynch-Howard incision here. Okay, this is the site of Lynch-Howard incision. After putting the Lynch-Howard incision, you can retract the skin and periosteum, and then you can go along with these landmarks to ligate the anterethmoidal artery as well as posterior ethmoidal artery. So that is the significance of knowing the landmark. Okay, so from the internal carotid artery you have the ophthalmic artery, and from the ophthalmic artery you have the branches anterior ethmoidal artery and posterior ethmoidal artery. And what else do you have? From the anterior ethmoidal artery it goes into the anterior ethmoidal foramen, and from the posterior ethmoidal artery it goes into the posterior ethmoidal foramen. Before going into the anterior ethmoidal foramen, anterior ethmoidal artery gives off the projection which is known as the Kennedy's nipple, which may be asked as a spotter for your exams. Now coming to the blood supply coming from the external carotid artery. How will you remember the blood supply from external carotid artery? What are the branches of external carotid artery? Before that, the branches can be remembered as Sister Lucy's pretty face often attracting medical students, right? Sister Lucy pretty face often attracts medical students. So you have the branches coming from the external carotid artery. What branches? You have the maxillary arteries branches. Okay, what are the branches of maxillary artery? You have the sphenopalatine artery as well as greater palatine artery and lesser palatine artery. And then from the facial artery, a few branches. All these are supplying the lateral wall of nose. Okay, the lateral wall of nose is supplied by the branches from the facial artery, branches from the maxillary artery in the form of greater palatine and lesser palatine artery, and sphenopalatine artery. Sphenopalatine artery reaches through the sphenopalatine foramen, which is seen 1 centimeter behind the middle turbinate. Okay, now coming to the blood supply of the nasal septum, you can see how the branches of sphenopalatine artery again coming from the maxillary artery, and then you have greater palatine artery, which is another branch of maxillary artery, and then you have the superior labial artery, which is a branch of facial artery. It gives of the septal branch, and along with that you have the anterior ethmoidal artery and posterior ethmoidal artery, as you saw in the other pic as well. Anterior ethmoidal artery and posterior ethmoidal artery coming from the ophthalmic artery to supply the lateral wall of nose. Just like that, here also it is coming to supply the nasal septum. Now all these are going into an area in the anteroinferior part of the nasal septum, and this area is what is meant by little area. It is called the Little's area, and the plexus which is being formed here is what is meant by Kasselbach's plexus. It is not Stewart's Little's area, it is just Little's area. Okay, in the anteroinferior part of septum, and this plexus is what is meant by Kasselbach's plexus. That is the plexus seen in the anteroinferior part of the nasal septum. And often question is asked, which are the arteries, or which is the artery that is not participating in this Kasselbach's plexus. If you look carefully in this picture, you can see the answer. You can see that the posterior ethmoidal artery is not reaching up to the anteroinferior part of the nasal septum. So it is posterior ethmoidal artery which is not participating in the Little's area or the Kasselbach's plexus, whereas anterior ethmoidal artery, superior labial, sphenopalatine artery, superior labial branch of the facial artery, and greater palatine artery, all these are part of the Kasselbach's plexus. Okay, so you have the anterior ethmoid artery, so you have the greater palatine artery, the superior labial artery, anterior ethmoid artery, and the sphenopalatine artery. Okay, so you can remember it as glass. Okay, the greater palatine artery, labial artery, anterior ethmoid artery, and sphenopalatine artery. These are the blood vessels which supply the Little's area. Okay, Little's area. So this is a question which is often asked. Okay, direct question. So you should not forget it. Now I told you the sphenopalatine artery is coming through the sphenopalatine foramen. It is situated 1 centimeter behind the middle turbinate. As you can see here, 1 centimeter behind the middle turbinate, you have the sphenopalatine foramen. Now, what does this sphenopalatine foramen lead into? Okay, sphenopalatine foramen is actually a connection between pterygopalatine fossa and the nasopharynx. Okay, sphenopalatine fossa, pterygopalatine fossa or sphenopalatine fossa, both are the same. It is a fossa which is seen behind the maxilla. Okay, so what are the boundaries? Anteriorly you have the posterior wall of maxilla. Posteriorly you have the pterygoid plates. Superiorly you have the sphenoid body, and laterally you have the fissure, pterygopalatine fissure, which connects it with the infratemporal fossa, and medially you have the sphenopalatine foramen, which you already saw now, through which it is entering into the nasal cavity through the nasopharynx. Okay, so you have the posterior wall of maxilla here, and here you have the pterygoid plates. Okay, pterygoid plates which arises from the sphenoid bone, right? So it is forming the posterior boundary, and the greater wing of sphenoid little part is also coming here superiorly. So these are the boundaries of the pterygopalatine fossa, and lateral to the pterygopalatine fossa you have the infratemporal fossa, and through the infratemporal fossa enters the internal maxillary artery. Okay, and through the infratemporal fossa the internal maxillary artery enters into the pterygopalatine fossa through the fissure called pterygomaxillary fissure. Okay, pterygomaxillary fissure. Through that the internal maxillary artery enters into the pterygopalatine fossa, and from there it goes through the, from there it gives the branch sphenopalatine artery, which goes through the sphenopalatine foramen to supply the nose. Okay, internal maxillary artery gives the branch called sphenopalatine artery, which goes to the sphenopalatine foramen. It also gives another branch called the greater palatine artery. Greater palatine artery goes downwards through the palate, and it goes on to supply the palatal area and also anteroinferior part of the septum. Okay, so how does it go? It goes through the greater palatine canal. Okay, greater palatine canal. So in the pterygopalatine fossa you have the internal maxillary artery, and from there it gives the various branches. The sphenopalatine branch goes through the sphenopalatine foramen, and through the greater palatine canal goes the greater palatine artery. Okay, now this pterygopalatine fossa is connected with various canals, and what are they? You have the inferior orbital fissure through which it is connected with the orbit, foramen rotundum through which it is connected with the skull base, and through this foramen rotundum you have the maxillary nerve. Okay, maxillary nerve being transmitted, and then you have the pterygoid canal which is connecting it with the foramen lacerum, and through this opening goes the nerve of pterygoid canal and the artery of pterygoid canal. Then you have the palatovaginal canal connecting it with the nasopharynx, and so these are the various structures that are seen in the pterygopalatine fossa. You will be learning more about pterygopalatine fossa when you are dealing with JNA, because JNA spreads through the fissures and foramina of the pterygopalatine fossa. So here you have the maxillary artery and its branches, and what are the other structures within the pterygopalatine fossa? You have the maxillary nerve and its branches, and you also have the pterygopalatine ganglion, which is subtended by the maxillary nerve. Okay, so these are the structures within the pterygopalatine fossa. And so you have external carotid artery and its branches, that is maxillary artery and facial artery. Now the branches of maxillary artery, that are the sphenopalatine and as well as greater palatine are given off, which supply the nasal cavity, and from the facial artery you have the superior labial artery. Okay, so this is how the blood supply to the nose commences. Okay, so now you have a rough idea about the blood supply of the nasal cavity, and so you have another method to control, right? You can go into the sphenopalatine foramen and ligate the sphenopalatine artery endoscopically. Okay, now with the advent of endoscopes, we always prefer the endoscopic route rather than going through the external route, which can result in a unnecessary scar, right? So that is the importance. Now, what are the various causes of epistaxis? Okay, so we have now learned in detail about the blood supply of nose. We have learned that the nose is being supplied mainly by the branches of internal carotid artery and external carotid artery. We have learned what are the major branches which are supplying the nasal cavity, and how internal maxillary artery is dividing into its various branches within the pterygopalatine fossa, and you have learned about the boundaries of pterygopalatine fossa, that is anteriorly you have the posterior wall of maxilla, posteriorly pterygoid plate, superiorly sphenoid body, right? And you have learned how the various branches are getting transmitted from the sphenopalatine foramen. Okay, through the inferior orbital fissure you have the infraorbital nerve. Through the pterygoid canal you have the artery of pterygoid canal, and to the foramen rotundum you have the maxillary nerve. Through the palatovaginal canal you have the blood vessels going to the palate, okay, oropharynx, okay, and through the greater palatine canal you have blood vessels going into the palate again, and from there only the greater palatine vessels supply the nasal cavity. Okay, so coming to the topic of epistaxis, what are the various causes of epistaxis? In children, the most common cause is actually due to a trauma to the nose. Okay, trauma to the nose is the most common cause, whereas in adults the most common cause of epistaxis is actually idiopathic.